Hi everybody, my name is Chris, but you can all just call me Kirby. That's my name. I'm from DeSoto, and my whole take on this Obamacare legislation is that, I'm all for healthcare reform. I'm all for it. But this legislation is not reform, it is mandates. And I don't have a job, I don't have health insurance right now, I need to get 2 teeth pulled, and I sure as heck don't want a bureaucrat telling me when I can get my teeth pulled, where I can get it pulled, what doctor I need to go to. Another thing that I just want to address is this Obamacare legislation is not reform, and it's a blitzkrieg. He is passing through it so fast, it's ridiculous. This is what I have to say. Tell Claire this. If she votes for this legislation, she best be shaking her boots. Because come 2010, those boots are going to be made for walking.
Good evening. My name is James Donegan from St. Charles, Missouri. It's apparent to me that everything I've heard up here tonight, the only people who seem to be telling us that Medicaid is broken are the politicians. Everybody's happy with their insurance companies, and the gentleman before me, we started talking about how many Americans are not insured. Why go through all this trouble? Take those 8 to 10 million people and put them on Congress's There's a bill that all of our elected people seem to be very happy with, and if there's room for the rest of us, we'll all go on that program. And I fully concur with the gentleman before me. If Senator McCaskill votes for this bill, I will work diligently. And
Good evening. My name is Jim Dale. I live in beautiful downtown Valley Park. The question comes from a 60-year-old cancer patient. I've listened diligently to what President Obama and others have said to say about this quote-unquote healthcare plan. The 3 things that I've learned for sure, I want to repeat, and then I want to see if you can clarify the 4th one for me. The one thing that I've learned for sure is nobody really knows what's in it.
Some of us do.
There's one. The second thing I've learned is nobody really knows how much it's going to cost. The third thing that I've learned is that we don't know how we're going to pay for it. We can't because we don't know how much it costs. The 4th part is the part that comes near and dear to my heart and is very personal. At what point does the government say to me, it's your patriotic duty to die? I want that answer. Not in general terms like page 146. I want an answer at 60, at 65, at 70, at 75, at what point do they tell us we have to die?
Answer the question. I am here this evening to take your concerns and questions back to the senator. As I started off, I don't have answers to all of the questions that are raised. There's a public forum here for you to share your concerns. As her representative here, I'm here to listen, and I'm happy to take those concerns back. She is in D.C. working. Yes, sir. Yes, ma'am. I'm taking notes.
I'm Pamela Cagro, MD. I came 100 miles from Rolla, Missouri. of the class of Washington University School of Medicine 1985. Are there any other physicians in the crowd who would like to declare their presence?
Back in the back.
I have to say that everyone before me has made some very good comments, and I want to thank you for the opportunity that you've afforded us to come and talk to you. And I want to thank Americans for Prosperity, Chuck Bearden and his people for allowing us this opportunity, and the community college here. There's several things that concerned me. I watched the 400-page bailout bill pass with people admitting not to have read it before voting yes. And I watched the 1,300-page cap and trade bill pass. Not having really even been constituted as a 1,300-page bill before people voted for it to pass.
And they should resign.
And when I realized that House Resolution 3200, which is the House version, was over 1,000 pages, and the Senate version, which does not have a number to my knowledge, the Affordable Health Choices Act, was 615 pages, that got me fairly worried. Number two, I watched part of the HELP committee hearing, housing, health, education, labor, and pensions, which is chaired by Senator Kennedy, although he was absent and Senator Dodd was filling in his place. Chris Dodd.
He's gone.
And I saw how many senators voted against making health care reform plan mandatory for senators and their staffs. And I'm wondering why that would not be in the bill, not to afford the senators and their staffs and government employees in general choice, but why not to make the plan mandatory for them? And I'm kind of losing my train of thought. The last thing I wanted to tell you was I ran a booth at the little rural Phelps County Fair, which was